BSN TV Channel 23 News.
Hi, my name is Sophie, and I'm the Chief Nursing Officer at Middleton Memorial Hospital.
And I'm Langley, and I'm a representative for the State Board of Nursing. We're here today to talk about a medication error that happened at Middleton Memorial Hospital and provide education on safe medication administration. As a State Board of Nursing representative, I find this topic very important, and I want to provide education to ensure the safety of all of our patients and for this to be a learning experience for all healthcare professionals.
Now we're going to get started with the interview, starting with what constitutes a medication error.
So a medication error is any error that could cause harm to the patient. This could be a miscalculation of dosage, this could be the wrong time, just anything that would harm the patient using medication.
And so who is responsible for maintaining safe medication administration?
So ultimately, the nurses are responsible for safe medication administration. So the doctors will prescribe and give their best judgment on dosage, but we are the last chance for any medication to be checked. So we are responsible for making sure it looks okay and catching any errors.
Okay. And what are the rights of medication administration, and why is it important for nursing practice?
So the 7 rights of a medicine administration is right person, right reason, right route, right medicine, right dosage, right time, and right documentation. And these are very important just because it gives a nurse a step-by-step process to make sure that the medication is given safely, and it's also a way to prevent medication error.
So what are the potential risk factors for medication errors?
So some risk factors for medication error are injuries, severe changes in neurostatus, as well as respiratory status, disabilities, and even death.
And what are the roles of nurses in preventing medication errors?
So nurses should always educate their patients on their medications. We should always be telling our patients what the medication is, what it does, some common side effects, as well as things to look out for when they're taking the medication. And the normal dosage for that patient should also be taught to the patient. And then we should always make sure that the 7 rights are intact when we're giving the medication.
What are some medication error risk reduction strategies that could be implemented?
So once again, we could always use the 7 rights of medical administration. Just asking the doctor, calling the doctor when we see something doesn't look right. We could have another nurse double check to make sure we heard the right thing on the phone, as well as prepare medication for one patient at a time and avoiding distractions.
What is the procedure when a medication error does occur?
So if the error has a potential to be stopped, we will stop it first to make sure that the patient is safe. We should also report the event immediately to staff and providers, as well as document the event and take action to ensure that this event doesn't happen again.
So consider the care of the caregiver who made the mistake.
So a lot of time in this instance when medication errors occur, the caregiver can feel a lot of guilt, and so we provide them with just emotional support, as well as we can implement therapy or support groups for them.
Okay, now we're going to discuss the situation that happened at Middleton Memorial Hospital. So the nurse was scheduled to give a powerful blood pressure medication to one of her patients. While she was preparing medication, she was laughing, messing around, not really paying attention. And then she ended up double dosing her patient with this medication. So because of that, her blood pressure plummeted. And luckily this was not fatal in this situation, but it definitely could have been. And the medication was not given as prescribed. So considering everything we just talked about in this video, it is crucial to limit distractions and interruptions while preparing and administering medications. And that concludes our educational video.
Peace.
Hi, my name is Breanna, and I'm with the BSN TV 23.
Is it just me?
I thought you were cutting.
What